Welcome to the Deep Dive, where we unpack complex topics and turn them into clear, actionable insights. Today we're diving into something really timely and relevant for a lot of you, especially if you're relatively new to Medicare. Imagine this scenario. You've been on Medicare Part B for about a year, maybe a bit longer, and your doctor, your primary care physician, suggests scheduling a Medicare Annual Wellness Visit. Hmm. Now, that phrase, well, for many people, it probably makes you think of a typical physical, right? Gown, cold stethoscope, the whole deal. But what is it exactly? Is it really physical? Is it free? And honestly, what should you expect when you actually go? So that's our mission today. We want to give you a really crystal clear picture of this specific Medicare benefit. We'll walk you through the whole thing from, maybe getting a questionnaire beforehand right through to the appointment itself. The goal here is for you to feel totally prepared, confident when you walk in for that visit.
Exactly. And this isn't just about, listing bullet points. It's about understanding the idea behind the visit. Why does Medicare even offer this? It kind of represents a shift, a proactive approach to health. We've looked at the official Medicare guides, resources for doctors, and even what actual beneficiaries have experienced to try and clear up what can be, well, pretty confusing. We'll clarify those common mix-ups, point out the key parts, and explain how this visit isn't just, another checkup. It's actually a powerful tool for your long-term health. By the time we're done here, you'll know exactly what a Medicare Annual Wellness Visit is for, and maybe more importantly, how you can really get the most out of it.
Okay, great. Let's unpack this specifically for someone who's right in that spot.
Yes.
But about a year into Medicare Part B, getting the suggestion from their doctor. What's the very first thing they need to understand about eligibility? Is it straightforward?
Well, that's a really important point about the timing, and it often trips people up. See, if you've just joined Medicare Part B within your very first 12 months, Medicare covers something different first. It's a one-time welcome to Medicare preventive visit. Think of it like an initial health check-in. Your doctor's even encouraged to try and get it done within your first 90 days. Then, after those first 12 months on Part B or up, that's when you become eligible for your first annual wellness visit. And this initial annual wellness visit, that's also just a once-in-a-lifetime benefit.
Ah, okay. So if you're listening and you really are about a year in, you've likely gone past that Welcome to Medicare window.
Right.
And you're now stepping into eligibility for that first official annual wellness visit. And after you have that initial one, then it becomes a subsequent annual wellness visit each year after that, like once every 12 months.
Exactly. Subsequent AWV, once per calendar year, basically. But here's something that's really fascinating, and honestly, it surprises a lot of people. While Medicare covers one of these wellness visits each year, the welcome one, the initial AWV, or the subsequent ones, it is absolutely 100% not mandatory.
Oh, really?
No, you're not required to have an annual wellness visit to keep your Medicare coverage. It's totally optional. It's a free annual chance to review your health.
Okay, that free part sounds pretty key.
Yeah.
You said Medicare covers it 100% under Part B. So like no copay, no coinsurance, it doesn't hit the deductible.
That's right. Zero cost to you for the visit itself.
Wow.
Now, there's a small catch, or rather a condition. Your provider needs to accept Medicare assignment.
Okay, can you quickly break that down? What does accepting assignment mean for our listener?
Sure. It's pretty simple, actually. Accepting assignment just means your doctor or provider agrees to accept the Medicare-approved amount as full payment for that covered service. They won't bill you for anything more than the Medicare deductible and coinsurance, which for the AWZ itself is zero.
Gotcha.
So yeah, it removes that cost barrier, which is huge. It makes the annual wellness visit really accessible. It's Medicare's way of encouraging prevention without you worrying about the visit cost.
All right, now here's where things get really interesting, I think, because most people hear annual visit and their brain immediately goes to annual physical.
Mm-hmm.
But you're saying they're very different. And understanding that difference is, like, absolutely crucial.
Absolutely. It's probably the single biggest point of confusion we see. People assume AWV equals a traditional physical exam, head-to-toe check.
Sure.
But Medicare is very clear. It does not cover routine annual physicals, period. Think about it this way. The AWV isn't primarily about diagnosing or treating things you already have. It's about preventing things you don't have yet. So the annual wellness visit is fundamentally focused on prevention and health planning. That's its core job. Developing or updating a personalized plan just for you, identifying potential health risks early on, making sure your screenings and shots are up to date. It really represents Medicare trying to shift the focus from just treating sickness reactively to proactively managing wellness.
Okay, so if it's not that hands-on physical, what are some concrete things that won't happen during an AWV, or what should someone definitely not expect?
Right. So you generally won't get that traditional hands-on exam. Your provider probably won't listen to your heart and lungs with a stethoscope or press on your abdomen or check reflexes as part of the AWV itself. And crucially, the covered AWV service doesn't include diagnosing or treating new problems or managing ongoing ones. It also doesn't typically include lab work or x-rays as part of the free wellness visit.
And I can see how that causes confusion. We hear from people who are frustrated because they bring up, say, knee pain during their wellness visit, and then they get a bill assuming everything discussed would be covered under that free visit umbrella. But the rules are different.
Exactly. And that's why it's so vital you understand this going in. Your provider will assess your overall health to make that prevention plan. But if you start discussing new symptoms like that knee pain, or you need a refill managed for a chronic issue, or you get a treatment plan for something new or ongoing, well, those things are considered separate medical services outside the scope of the preventative AWV.
And if those separate non-wellness services happen during the same appointment, what happens with billing then?
Well, those extra services, the ones for diagnosis or treatment, they can be billed separately. And for that part of the visit, you might have to pay your usual coinsurance or meet your deductible.
Ah,
This is often called a split visit. It's why you might hear the clinic staff mention potential copays if you bring up new issues during your AWV. They're not trying to be difficult, they're trying to be transparent about how Medicare billing works for these combined visits.
okay, that distinction is super helpful. So we know what it's not. Let's pivot to what it is. If it's not a physical, what actually happens during this annual wellness visit? What should our listener, going for their first one, really expect?
Okay, so the absolute core of the AWV is something called a health risk assessment, or HRA. It's basically a detailed questionnaire. You report information yourself about your health status, risks for injury, behavioral stuff, any urgent needs.
Yeah, okay.
You might fill it out beforehand, maybe they mail it to you, or you might do it with a nurse or assistant right there at the visit. It's designed to be pretty quick, maybe 20 minutes max. And this HRA is really key because it helps uncover things, behaviors, or risks that maybe only you are aware of.
What kind of questions are typically on this HRA? What's it trying to get at?
It covers a really broad range, aiming for a holistic view of your health. You'll see basic stuff like age, gender, but also questions asking you to rate your own health, assess any frailty, how well you function physically. It also digs into psychosocial risks, things like symptoms of depression, how satisfied you are with life, stress levels, even anger, loneliness, pain, fatigue.
Mhm.
It's quite comprehensive.
Wow. And what about, daily life, habits,
Yeah.
the stuff outside the clinic walls?
Oh, absolutely. That's a huge part.
Yeah.
Asked about behaviors, tobacco use, how active you are,
Yeah.
nutrition, oral health, alcohol use, and really importantly, safety in your home. It assesses your activities of daily living ADLs, those basic self-care things like dressing, eating, using the toilet, bathing, and also instrumental activities of daily living IADLs. These are a bit more complex, things you need to live independently, like shopping, cooking, using the phone, managing your meds or money. And there's even an optional piece now, started in 2024, looking at social determinants of health, SDOH, non-medical things like your housing situation or transport access, which we know have a massive impact on health.
Okay, so that HRA sounds really thorough. It sets the stage. Once they have that information, what happens next during the actual appointment with the provider?
Right. So building on that HRA, the provider will then review your complete history, medical, family, social. That means past illnesses, surgeries, hospital stays, any allergies you have. They'll also go over your family history for hereditary conditions. And critically, they'll compile a full list of all your current medications and supplements. Prescription, over-the-counter, vitamins, herbals, everything.
Everything. Okay.
Yes, and also a list of all your other healthcare providers, specialists, therapists, everyone involved in your care. This helps make sure everyone's on the same page.
And I assume they'll take some basic measurements too, just to get a baseline for that day.
Yes, definitely. Routine things like height, weight, calculating your BMI, checking your blood pressure, those are standard parts of the visit.
Mhm.
Your provider will also do a screening for cognitive impairment, just looking for any early signs of memory issues or dementia.
Mm.
They'll also review risk factors for depression or anxiety, often using quick standardized questionnaires like the PH29 or a GAD-7. And they'll assess your functional ability and safety checking on things like hearing, your risk of falling, and general home safety.
So you gather all this incredible data from the HRA, the history, the measurements, the screenings. What's the end game? What's the actual output for the patient? What do they walk away with?
Great question. The main goal, the tangible output, is a personalized, written screening schedule. Think of it like a custom health roadmap for you for the next 5 to 10 years. This plan is based on guidelines from national expert groups, like the U.S. Preventive Services Task Force, but it's tailored specifically to your health risks, your history, your age. You'll get personalized health advice based on those risks. And if it makes sense for you, your provider might give you referrals. That could be to health education classes, preventive counseling, maybe community programs for things like weight loss, quitting smoking, diabetes prevention, that kind of thing. And there's another piece too. At your discretion, totally optional, they can discuss advanced care planning.
Ah, right.
Yeah, talking about your future healthcare wishes, things like living wills or naming a healthcare proxy. It's covered as part of the AWV if you want to have that conversation. Also, if you happen to be taking opioids, there's a required review of your use and pain management plan and an assessment for any potential substance use disorders just to ensure safety and support. It's really about building that comprehensive, forward-looking plan.
This honestly sounds like such a valuable opportunity,
Yeah.
especially like you said, because the visit itself is covered by Medicare. So for our listener who's maybe gearing up for their first AWV, what's your best practical advice? How can they really maximize this visit?
Preparation. Preparation is absolutely key. First off, make that list, a complete, accurate list of everything you take. All prescription meds, yes, but also over-the-counter stuff, vitamins, herbal supplements, everything. Include the dosages if you know them.
Okay, bring the bottles if unsure.
Exactly. If you're not sure, just toss the bottles in a bag and bring them. Better to have too much info than not enough. Second, make another list. This time, all your healthcare providers. Everyone.
Yeah.
Eye doctor, cardiologist, physical therapist, mental health counselor, anyone involved in your care. If the clinic sends you that health risk assessment form ahead of time, fill it out thoughtfully before you go. And maybe most importantly, bring your list, a list of your top questions or concerns specifically about preventative care or staying healthy. Not about your current aches and pains, remember, but about prevention. This makes sure your priorities get addressed.
Yeah, it really sounds like the focus is firmly on looking ahead, identifying those potential bumps in the road before they become major roadblocks. It's like a strategic planning meeting for your health.
That's a perfect way to put it, and one huge benefit is how it helps address care gaps. That's just a term for when you might have missed recommended preventative services or screenings according to the guidelines for your age and risk factors. The AWV visit itself actually helps meet one quality measure for doctors related to patients getting preventive care. But beyond that, your provider uses this dedicated time to actively look for and help close other potential care gaps. That could mean checking if you're up to date on your BMI check, blood pressure monitoring if you have hypertension, making sure your diabetes care is comprehensive, checking on breast or colon cancer screenings.
Vaccinations too.
Oh, absolutely. Flu shots, pneumococcal vaccines, others, depending on your situation. If they can't provide a service right then, they can order it or refer you, ensuring those preventive gaps get filled. It's like a system check for your health maintenance.
Wow. What an incredible deep dive into the Medicare Annual Wellness Visit. It's so clear this isn't just, another item on the medical checklist. It's a really crucial, no-cost tool designed to put you more in control of your health journey, shifting from reactive care toward proactive wellness.
It really can be transformative, I think, when you understand that key difference, AWE versus physical, and you come prepared with your info, knowing what to expect. You can turn this annual benefit into a truly powerful preventive strategy. It stops being just about managing sickness and starts being about actively shaping your future health, catching things early.
Absolutely. It's about taking the driver's seat. So if you're listening and your doctor has suggested scheduling that Medicare Annual Wellness Visit, remember what we've discussed. It's a free opportunity, a chance to get informed, to ask questions, and to actively partner with your doctor to build that personalized health roadmap. So here's a final thought to leave you with. Think about this. How might dedicating just one focused appointment each year, specifically to proactive health planning, rather than just reacting when symptoms pop up, how might that fundamentally change your long-term health story? Consider the possibilities: early detection, personalized advice, maybe just the peace of mind from having a clearer path to staying well. We really hope this deep dive has armed you with the clarity and confidence you need to approach your Medicare Annual Wellness Visit. Until next time, stay curious and keep diving deep.